Welcome to the A Different Kind of Psychiatry podcast, brought to you by the ACO. I'm Dr. Chris Burritt. Each month, we feature a patient interview, case presentation, or interview or discussion with one or more of our doctors who practice a different kind of psychiatry. We are interested in your questions and comments, and I would love to hear your feedback. Send an email to aco@orgonomy.org. The best way to help the American College of Orgonomy spread its knowledge is by letting others know about us. If you enjoy the podcast, we'd appreciate you leaving a rating and review. If you're interested in attending one of our webinar presentations, you can meet the doctors and join in on the discussion afterwards. If you're interested in training with the ACO, you can learn more about the medical orgone therapy or social orgonomy training programs. You can connect with us and learn more at orgonomy.org. This episode features the audio from one of our ACO case presentation series webinars. Dr. Edward Chastka tells me about a young man named Bill who he treated after recently being hospitalized and still recovering from an episode of psychosis. He had a problem with drugs and pornography, but he was also struggling with tolerating his intense feelings of pleasure in an exciting new relationship. Today's presentation is entitled A Sexually Confused Young Man and is presented by Dr. Edward Chastka. Dr. Chastka is a board-certified medical ergonomist practicing in Wyomissing, Pennsylvania. He treats children, adolescents, adults, and couples, and he's a member of the American College of Orgonomy, and he teaches classes in social ergonomy. So I'm really excited to hear about this presentation of yours. So why don't we start off just by, maybe you could say something about how you decided to present this young man today.
Well, there was a couple of things that attracted me to presenting this. One was he was just such a lively young man and so intelligent and had a lot of very good insight. He made very rapid progress in his treatment. But the other issue was that his problems were so similar to so many young people today that I see. Problems with drugs and alcohol, and problems with sexuality.
I see. So who was this young man and how did he come to your treatment?
Well, he came to me referred out of a psychiatric hospital, and he'd been at college, and he had started using a lot of drugs and alcohol, marijuana, alcohol, and then had started to add in some amphetamine later on in an attempt to kind of keep his head clear.
And what's his name?
His name is Bill.
Bill.
And he started to have periods where he felt kind of off and out of it. This involved the drugs and alcohol, but it also involved a new relationship that he'd gotten in. Now, he told me that he had always been a very sexually active guy, but he'd never had any kind of committed or long-term relationship. And his second year of college, he'd gone home and he'd met a young woman from another school, and he really fell for her. He felt deeply attracted to her and missed her when they were away. And this was a new thing for him. He seemed a little surprised that this kind of thing could happen. And I think it was almost too much happiness for him because when he got back to his school, he went back to his old ways, drinking, smoking marijuana, hooking up. In fact, the day that she was to arrive on his campus for a visit, he was out drinking and with another woman.
Wow.
Yeah. So, it was, clearly he was frightened and trying to undermine the situation. He didn't know what to do, and he kind of blew the situation up. Now the young woman forgave him and wanted to stay in the relationship, but this was too much for him. The drinking, the marijuana, the Adderall use got way out of control, and he started to develop some problems with his thinking. He began to get this overwhelming sense of how the world was evil and he was evil and that he needed to be punished, and then actually developed the delusion that he was in fact living in purgatory and being punished for his sins.
Oh, wow.
The drug and alcohol, of course, but also he had a lot of guilt about some past sexual behaviors. He was unable to sleep. He was up for several nights in a row, and his mind was racing, and he began to hear voices talking to him, seeing shadows in his vision, and he couldn't go to school anymore. So he went home, and he did a little better there, but his parents were very concerned. So what they did is they took him to the emergency room. He was evaluated. He was admitted to a psychiatric unit for about a week.
Mm-hmm.
Now, the interesting thing about this was most psychiatric units with this story would put you right on an antipsychotic.
Mm-hmm.
But this unit didn't. They wanted to give him a chance to clear off the drugs and alcohol, gave him a sedative for the first couple of nights, and after that, just let him clear on his own.
I see.
And referred him to me once he'd completed his stay there.
And so what was it like, that first appointment with him after this hospitalization and clearing from the initial intensity and real psychotic experience he had?
Well, when he came into the room, I could tell he was, a real live wire. He was just kind of lit up with energy, probably more than he could handle. And his eyes had this kind of burning look and staring off into space. And he was very expressive and talking really.
Like a zealot?
What?
Like a zealot?
Yes, it's like a zealot. And initially, he didn't want to hear what I had to say. He had this story to tell, and it was, I let him talk. But as I began to think about how do I approach this young man? He's so expanded, and yet his thinking is so off. I started to focus on two things. One is to get him to fill in the details of what he was saying, to be very clear, because his mind would skip things and things wouldn't be clear. So I would ask him questions and try to get him to talk more in detail about this belief that he was in purgatory. And it came out that he believed that the rest of the world was suffering from his sins as well, that his guilt was spreading to other people. And
he was a burden on everyone around him.
He was a burden. His sins were a burden on everyone else. So to get him to talk about this and really be clear about it. The second thing I noticed is what's called loosening of associations. So his mind would skip, and you wouldn't know quite where the next thing came from. So to help him get in touch with the fact that this was going on, I would always ask him to fill in the blank. How did you get there and what? And this actually brought him very quickly into an awareness that his mind was skipping like this. He became aware of it and began working on it himself.
And was he sober by the time he came to see you? Like, did he remain clean from drugs?
He did. And I think that was an important part of what was happening. A lot of people, when they stop using drugs, and particularly when they stop using marijuana, will get this rush of energy. And a lot of times they don't know what to do. In the 12-step circles, they call it a pink cloud. There's this rush of energy and emotion that you've been avoiding for so long, and your nervous system is coming back to life. You can look at drugs and alcohol as a way to avoid feeling. When I work with somebody with addiction problems, I always look at why are you using? What is this doing for you? You can't be moralistic about it. People use drugs and alcohol for a reason. And quite often it's things like anxiety, social anxiety, boredom, loneliness, longing for connection, depression. And so when people stop using, they get this rush of energy back. But also, whatever the original problem was isn't gone. The drugs and alcohol didn't cure it. So in this young man's case, it was a lot of anxiety about social things and about sexuality that he'd been kind of dampening down with these drugs. And now he was flooded with feeling. To his credit, he did not want to take medicine. Now, I would not have hesitated to prescribe it for him if necessary, because it's not uncommon for people in his situation, coming off of drugs, having some psychosis. But he wanted to face his feelings, and it worked out very well.
If I could ask two questions. One, did you say he was using Adderall before this episode?
Yeah, he had started adding Adderall into the mix. With people who use drugs, the drugs cause a problem, and they'll often add another drug to try to solve that. So he was using so much marijuana and alcohol that he was very foggy all the time, and he began taking Adderall that he got illegally. He wasn't prescribed. And he would use it, and then he would use it at night so he could stay up and drink more and smoke more marijuana. So he added that in, and stimulants themselves can cause psychosis. I'm sure you've run into that issue. Marijuana frequently causes psychosis. Stimulants, even the prescribed ones that are used for ADHD, can cause psychosis as well.
Yeah. And now, do you have a sense of, even though he was sober, although, only in the short term when he came to see you, that he was someone who tended to develop a psychotic reaction, or they were exclusively from the medicine? How did you see that?
Well, that's a good question. People want to know, and particularly parents want to know, is this a drug-induced psychosis, or is this, an underlying psychosis? And what I tell people is both. There are lots of people out there who can use stimulants and marijuana all their lives, and they'll never become psychotic. And then there are other people who become psychotic without them. So it's really a spectrum. Mm-hmm. If you think of a psychosis as the breakdown in the functioning of a person's defenses, and that this can be brought on by using drugs, then you can see that, yes, drugs can bring on a breakdown in a person's functioning, but other things can too.
So, and also maybe it would be good to clarify, a lot of people, I think, do think of medicine being the treatment for someone who's psychotic, whose thoughts are disorganized. Could you say more about working with someone like that, and him specifically?
Well, it was in some senses a rare opportunity, because people in a psychotic state are often flooded with anxiety, and they can be difficult to engage. In a psychotic state, the mind splits, and the perceiving part of the mind splits from the excitation coming in from the senses and the body. And this split allows for misperception and delusions and hallucinations. So that can make it very hard to connect with a person initially.
Yes.
And sometimes the best way to bring them into contact with reality is to use medicine. But with him, number one, he'd cleared a lot in the hospital. Mm-hmm. He was already getting better by the time he came to see me. And he had the curiosity and the willingness to face what he was feeling. He was excited about it, in fact.
Yeah. And what I heard from you too, the fact that you were able to help him clarify with your questions seemed to be a sign that you could work with him that way. If that didn't work, maybe that would be a sign that you would need to use medicine. Is that accurate?
That's correct. That's exactly the way to approach it. But to let a person go as far as they can on their own and with their own resources.
Yeah. So I'm curious to hear more. How did things develop?
Well, as time went along, we were working with the psychosis. It developed that there was more to the story than just drugs and alcohol, and even the relationship with the young woman. And of course, there always is. He'd been conflicted about his sexuality for a long time. In high school, he'd had a lot of hookup kind of behaviors, and that had intensified at college. And in a way, he kind of didn't recognize that there could be anything more to a relationship except a casual, sensual hookup, usually under the influence. And it surprised him. So there was this eye-opening experience with this young woman where he felt this emotional connection with her. And then even later on in the therapy, it came out that he had been engaging online in some pornographic. For one thing, he'd been addicted to pornography for many years. Pornography, excessive masturbation. And this is a common thing that I see. And in fact, he considered himself more addicted to pornography than he was to drugs. But young men and young women, even more and more today, will watch pornography, be very stirred up sexually in a sensual sense, will masturbate to it, but they can't get relief from this high excitation. And it leads to this compulsive rounds of repeated watching of pornography and masturbation without genuine emotional satisfaction. And it's addicting and frustrating at the same time. And he had had this going on since high school. And then at one point, he got involved in some pornographic behavior himself. He started to post pictures and short videos of himself, initially naked, later masturbating to older men. And he felt extremely guilty about this. We talked about his various experiences, and he said that he had always felt that he was heterosexual, but these behaviors had made him wonder, was he bisexual? Did he have some kind of transsexual identification or what? But that became a little clearer as the therapy went on. But he had this tremendous guilt over what he had done. And again, that had led to increased use of drugs and alcohol, trying to stuff it down. And then later, when the psychosis hit, flooded with guilt. And I think that was a lot of the guilt and the shame over this was, the breeding ground for this delusion that he was evil and had to suffer in purgatory for his sins.
I see. And so this was happening when he was in high school and then early college, and this was all something that no one else knew about in his life?
He had not been in treatment, and he hadn't talked to anybody about it.
His family, or
he hadn't talked to his family about it. He thought he could solve it himself, and a lot of people do that. They'll try, I'll use drugs. That'll, that's sort of a subculture in the world today. That you can just use drugs and take care of any problem.
Dr. Chastka, you said something about his curiosity, but is it accurate to say there's also an openness to him? Because talking about something that intense, even in therapy, sometimes takes years for people to do. Yeah. Could you comment on that?
Yeah, well put. That's really more than curiosity. One of the things that was very attractive about him was his openness. Many times it takes years before someone's ready to talk about their sexuality. Now, part of that was the psychosis. There's this breakdown of normal societal values, and that helped him. But he didn't have a bad reaction to it. Many people, often a psychotic person could tell you all these deep truths about themselves and then become paranoid of you. And, oh, I said too much. This is horrible. I'm a terrible person. He didn't get that reaction. He liked the connection we were developing, and he grew with it.
I see. Was there any paranoia involved in his symptoms or involved in his therapy?
Limited.
Uh-huh.
Yes, in that, in the beginning, he presented it as a drug and alcohol problem. And then after a while, he knew he could trust me. Then he talked about the girlfriend versus the promiscuous behavior. And then a little while longer, and he talked about the pornography and the masturbation. And the last thing was this exhibitionistic videos that he posted online.
I see.
So it was stepwise, but really remarkable that someone could go that far and that quickly.
Yes. And Dr. Chastka, was he in school still while he was in therapy with you, or did he take time off, or what happened?
I advised him to take time off, and he wasn't ready to. He wanted to go back to school, but he wasn't ready. It could have led to another break. It's hard enough to recover from a psychosis and from drug and alcohol use when you're focusing on your therapy. But to put himself back in the situation where all this had taken place and where many of his friends were using drugs heavily, and there was this, casual sex type of atmosphere going on, it would have been very risky to him. I advised him, I told him he should take a year off. He wasn't happy to hear that, but he at least took my advice and actually wound up, at the end of the program, going someplace into a sober living community.
So maybe you could say
very open to my advice. He took it.
Uh-huh. Can you say more about that in terms of how things progressed in your treatment with him?
Well, when we got to the part about the homosexual behaviors, his anxiety kicked up again. And we sat down and we had a talk about it. And I said, you're questioning what your sexuality is. Where are your feelings? Which of these relationships has given you the most satisfaction? Where do you want to put your energy? And when he looked at it, it was really far and away and easy for him to decide that what really interested him the most and gave him the most satisfaction was the relationship with this young woman. Because there was more to it than just hooking up sexually. He really liked her, and this kind of surprised him. He hadn't had that before. But also, he had to learn to tolerate that kind of feeling. Love is a tremendously powerful and expansive feeling, and he wasn't used to it. And he certainly wasn't used to tolerating feelings without drugs. So once he had recognized that this is what he wanted to pursue, then he had to set himself on a path where he was going to be able to tolerate it, tolerate the excitation, to tolerate the happiness.
So was he with this young woman while he was in therapy with you? Was that part of his therapy, his continued relationship with her?
They continued to have a relationship, but they weren't seeing each other physically.
Uh-huh.
He had he was kind of taking time off from that too to get himself together, and probably rightly so. That again, to jump back into that could have had the same kind of effect on him that jumping back into college did. But they were staying in touch. She was following his progress.
I see. So it's a more superficial, limited relationship, enough that he could take that, he could tolerate that.
Well put. He backed off a little bit to a level that he could stand and not have to use drugs and alcohol and not have to become psychotic.
Wow. Could you say something about satisfaction with love and sex? Because I think that some people may use that term and may have different definitions of it.
Yeah. Well, I think that for him and for many people, it's a revelation that an emotionally connected relationship can be much more satisfying in itself, but also can lead to a much more satisfying sexual relationship. So when there's deep love in the sexual act, it's more moving and more satisfying.
When I think of satisfying, I think of almost when you're satisfied, you don't want more. It's not like when you were mentioning with pornography where, he's compulsively going for more and more and more. There's some aspect, and I don't think it, you quantify it. It's different for different people, but there's some aspect of a lull where you're satisfied, you're content.
Right. And you let things build up.
Yeah.
And that's an interesting point about what you said before about them kind of backing off. They jumped into a sexual relationship really fast, and they backed off, and they were starting to talk more to each other. And I think that was a very good thing too.
To get to know each other.
Yeah, what a concept.
Yeah. Wow. And so then what?
So we got to this, and I could see his thinking starting to coalesce again. When he'd talk about this sense of being in purgatory, he'd say, well, I realize that's not really going on. I still think it might be, but you could see his mind start to get put back together, his normal mental defenses. And what came out, and I think it was probably something that was part of his character and for a long time, is he was an overthinker. He thought obsessively about a lot of things. Now, this is not something that I would want to stop at that point. This is him putting his brain armoring back together. But he would think obsessively. He'd have to, go into things too much. And I did point it out to him, and he agreed, yeah, I think too much about things. But at that point, it wasn't a bad thing. It was him developing some armoring and some defenses.
Gotcha. I think you said something, you alluded to him going to another program or a housing program.
Well, he'd been initially resistant to any specialized drug and alcohol treatment. And when he came in and he was in that expansive messianic state, with the glowing eyes and everything, I'm never going to use again. I don't need that stuff. But as he got back to himself, he began to have strong urges to use again, and he was starting to struggle. And at that point, he was seeing a drug and alcohol counselor at the same time. And we got together and we decided that...
You and the counselor got together?
We talked, yes. And decided to, he was past the need to go to rehab, but that to be involved in a therapeutic community where he would learn to belong to the 12-step community and learn how to get support from other people, and the basic
structure
and its tendency of addiction and how to fight it. And it's really an armoring process, a defensive process of learning that these urges are going to come. They're going to come at you in a disguised way that's going to make it look like it's really the right thing, whether it's, I haven't had any desire to use in so long, so I could just use once, or, I never used this drug, so I could probably use a little of this. And your mind will trick you into relapsing. So if you go and you become part of a recovery community and you learn about these things and you learn the steps to take, which is to belong, for most people, to belong to a 12-step community, either Narcotics Anonymous or Marijuana Anonymous or Alcohol Anonymous, it is a very valuable thing. And to develop the people you can call and talk to about your situation. And working the steps is very valuable too. I happen to see the 12-step program as being a systematic way to reform the normal social defenses, of being honest, of not stealing, not lying, being responsible. And so I encourage patients who have drug and alcohol problems to participate in that.
Okay.
And there's the idea of the higher power too, which I think is very helpful. The concept of it's important to feel like you belong to something bigger than yourself. And that's, I think that's the best way. The 12 steps, you don't have to go to church or believe in religion or even have any specific concept of God, but the sense that you're part of some bigger aspect of nature or creation. And it fights there's a certain narcissism in addiction that in AA they call it, I want what I want when I want it. And that becomes the most important principle in your life.
Yeah.
And of course, that's usually a drink or a drug or, and you get into this cycle of just satisfying this narcissistic need. And, that belonging to something bigger than yourself helps overcome that narcissism.
I hadn't heard it put that way. I like that.
It's good. They have a lot of great sayings that put things in a pithy way.
Yeah.
Or very much character and analysis.
Yeah. So how long was this time that you worked with Bill for, from when he first got out of the hospital to when he went to the sober living?
8 weeks.
8 weeks.
So this
all of that came out in 8 weeks.
8 weeks.
Holy cow.
Yeah. Yeah, he was amazing. He was, and I'm sure down the road there's trouble. He's not through with his, there's going to be issues with mistrust with him.
Mm-hmm.
There's going to be issues with, cravings for drugs.
Mm-hmm.
His mind's going to tell him, he's going to be anxious or lonely or in conflict with his girlfriend or something. And the brain's going to tell him, you can get rid of all this if you just get high again. So there's a lot more work for him to do.
Yeah.
But I think that for the time we had together, it was pretty remarkable.
Yeah. Yeah. Perhaps one day in the future, he'll call you again.
Yes, I'm hoping so. Yeah, he went out of state. So I can't see him until he comes back in the area, but hopefully will, and hopefully we'll reconnect.
We can do a second webinar maybe.
Yeah.
Before I move on to questions from the audience, is there anything else about his treatment progression that you'd like to let the audience know about?
Let's see. We covered most of it. I guess the one thing that we didn't hit on too hard is the destructiveness of the internet and internet pornography in young people's lives. I know that I work some time at a drug and alcohol rehab.
Mm-hmm.
And one of the things we do is cut off that connection. There's very limited access to computers, to cell phones, even to TV. And it's remarkable.
What do people do?
Yeah, they talk to each other. It's the most amazing thing. They talk. They have a service, a non-denominational service, and they have little shows where they sing and get up and talk about their treatment. It's like the old days before we had these things. People talked to each other and entertained each other.
Wow.
But so many of them, and I always make it part of my evaluation, what's your pornography use? What's your video game use? What's your use of social media, YouTube, your phone? And so many of them, it's a massive part of their lives. In fact, in many young men, the first addiction is video games, even before they touch marijuana. But most of them find that they really appreciate the time away. Some of them will complain, but to be away from that phone and the internet, is liberating and a revelation.
Do you know with Bill how early he got into pornography, and was that something that came up during?
I can't remember specifically. I would guess from the way he described it, probably 13 or 14.
I see.
Right at the cusp between middle school and high school. And I think that's a very common time. And young people have a lot of access to this stuff on the internet, children.
And I like what you highlighted, which is it's whether with drugs or pornography or social media and video games, it's not moralistic, but what is this actually doing for you? And are you happy with how things are, essentially?
Yeah.
So let's look at some of the questions from the audience.
Okay.
There's one question here. What role, if any, did his relationship with his family have in the problems he was having?
Well, that's an interesting point. I had no contact with his family. He handled this whole thing on his own, which was
that's kind of remarkable itself.
It was remarkable itself. And I didn't even think of that until this question came up. But he handled it all on his own. What I do know is that he trusted his family enough to go back there when things got bad. And when they saw the shape he was in, they had the sense to take him in for an evaluation and get him treatment. Mm. So to me, that speaks of a pretty good family relationship. But other than that, he handled it on his own like an adult.
Wow. There's a question here. You mentioned he had 8 weeks in therapy. Do you find young people react more quickly to therapy than older adults?
That's a good question. Young people, as in children, yes. Young people, as in young adults, yes and no. In some ways, they're much more flexible, but there's often a mistrust of authority that you have to work through first. Now, with this guy, that wasn't much there, and that allowed his therapy to progress very quickly. But there's a pervasive mistrust of traditional authority now in our society. And that means teachers and parents and doctors and therapists. And typically with someone his age, it takes a lot longer to break through that. With him, it just wasn't there. And I don't know why. That may have been part of this psychosis, is it just swept away so much of the, social facade that he had.
Yeah, interesting. I'll say from my own experience, you said it takes longer. It almost feels like it's like a solid year before someone really looks at you as an authority when we're talking teenager to young adult. And I have numerous experiences. Even when things are good between us, it's like what I say is on par with a friend or what you read online. It's not that it's dismissed.
And this much below the video influencer and the rapper,
Yeah, but it's like just another idea among many that they're considering and looking at,
That's right.
Yeah. And
I'd say for an addict, it's probably 2 years usually before I get to the point of seeing them on the couch, doing any biophysical work. Now, which none of that I did with him. But it's quite often 2 years before the character is put together well enough again that they can tolerate that kind of work.
Yeah. Wow. There's a question here. In all of your years as a therapist, are you seeing that young people today are truly having more problems with their sexual identities, or that some kind of media hype?
Wow, that's a good question. I think that people have always struggled with sexuality. There's always been tremendous anxiety with young people, adolescents in particular, with the sexuality, but that in the past era, there were expectations, and you might break them. So, say you might have sex before marriage, and that might have been, kind of a no-no, but you kind of knew where you stood, and that gave people some structure that helped them tolerate the anxiety of sexuality. Now it seems like that's gone, and anything goes. And if anything goes, it's more anxiety provoking, because you got to decide what goes for you, in addition to any fears you might have about yourself, or about connecting with other people, or about what sex is like, or what my partner is going to think of me. Or so I do think it's worse for them, but I do think there's also a hype, and particularly there's a hype of let's not look at emotion, let's not look at connection, let's just look at anything goes. And I think that makes the problem worse.
Yeah, I like how you put it. I agree with what you said. The old school repressed, very moralistic view of sexuality, even though it had structure that could help, kind of give you guidelines, even if it didn't quite fit how you felt. But now with anything goes, it's just so unclear, and with people being less just in touch with themselves. And that's what you were really talking about with Bill, which is if he's out of touch with himself, he can't even figure out, am I attracted to men, women, this, that. He just isn't connected with himself. And unfortunately, people have been less connected with themselves. And then if you combine being less connected with yourself in a society that's less structured, for better or worse, I think it adds to the confusion.
And I think that this is leading to a new phenomena that I'm reading about online of asexuality. People who just throw up their hand, I'm not sexual at all. I'm not interested. I'm not even putting a toe in the water, and just withdraw from it entirely. And of course, that's a tragedy to lose that special connection that we have as mammals and people and biological beings.
Yeah. And on this note, there's another question. The person wrote, what's the difference between sexual confusion and actual homosexuality? I think we touched on it, but...
Well, homosexuality, someone is attracted to people of the same sex, and they're clear about it. They're not confused. And in fact, many will tell you, oh, I knew that from the time I was a child. But confusion is this, am I homosexual? Am I heterosexual? Am I polyamorous? Am I someone who wants to be in a committed relationship? This was the confusion he had, and particularly the confusion he just didn't understand about an emotionally committed relationship. Somehow he never said as much, but it struck me as almost it hadn't occurred to him.
That's amazing.
Yeah.
Yeah. This question we touched on, but maybe we can reiterate. Is viewing internet pornography very common among young people? And the second question is, where are the parents?
Well, I'll get rid of the first question. I don't know where the parents are. They certainly are not that involved. But I think internet pornography from the young men that I see is extraordinarily common. And a lot of them will put it behind them if they get into a relationship. Some never do. Some of them will try to combine pornography with a relationship. I think that always hurts the relationship. Another interesting thing that I saw online 2 weeks ago is that something in the neighborhood of 35% of young women watch pornography, which is not something I'd realized. I now start, with the young women addicts that I see, I now add that to my evaluation because apparently it's women are becoming much more involved with pornography too. I don't have as much experience with that.
Yeah. I have a young man that I've been working with, and this came up actually fairly recently. He's about 25 and in a committed relationship. And what was striking about what he said was with his pull to pornography, there was this lack of shame about whatever he'd want to do sexually. He didn't have to bring it out into the open in his relationship. Right. And he doesn't even know if that's acceptable or not. It's just, it can't even come up. There's so much shame there involved.
Yeah.
But there was also this aspect of it of it's all about me. Like, I don't have to worry about the other person at all.
Yes.
And that really was striking.
Yes. I think you've hit on two very important points. Well, one is it's liberating in some way for people. They, they don't have to worry about their guilt and their inhibitions. But also there's nobody there but a screen.
Yeah.
People excite each other. And there's a lot more potential for that if there's two people rather than one.
It almost sounds so simple.
Yeah.
One of my mentors, I think it was Dr. Chris, said something about two people, just somehow that seems to be a stable pair,
Yeah.
1, 3 doesn't seem to be satisfying, but somehow 2 seems to come together.
Yeah, I don't think threesomes quite work out as well either. Somebody's always kind of left out.
Anything else, Dr. Chastka, you'd like to say before we wrap up this webinar? This has been a wonderful discussion.
Just that this young man is such a good example of how far people can go in therapy if they simply trust the process, connect with the therapist, and open up and say the truth. Say your truth and what's on your mind, and it will take you a long way.
Wonderful. Thank you, Dr. Chastka.
All right. Thank you, Dr. Burritt.
How do you feel after listening to Bill's story? What do you think? I'm rooting for Bill. I hope he can stay sober, face his feelings, and see where his relationship with his girlfriend goes. The best way to help the ACO spread his knowledge is by letting others know about us. I hope you share this podcast with your friends and family and let them know about our work. You can connect with us at orgonomy.org. I'm Dr. Chris Burritt. Thank you for listening to the Different Kind of Psychiatry podcast, brought to you by the ACO. Since 1968, psychiatrists affiliated with the American College of Ergonomy have been helping patients discover greater satisfaction, health, and overall well-being in their lives. Whether patients suffer with mental illness, struggle with addiction, or feel unsatisfied with their work lives relationships, medical orgone therapy, as practiced by the physicians at the ACO, offers a way forward, often without the use of medication.